Welcome back. It's 23 minutes to 11. You're watching and listening to Britain's Newsroom on GP News.
Now, I've got to say I'm struggling with this because a major new clinical trial will, for the first time, test rigorously, they tell us, the risks and benefits of puberty-blocking drugs for gender-questioning children who can be as young as...
8, I think.
Young as 8.
Well, this study is being run by King's College London, and it will involve around 220 young people under 16. We're going to talk now to Helen Joyce, who's the Director of Advocacy for Sex Matters. Helen, I thought we'd been through it. Forgive me. Good morning. Very nice to see you. I thought we'd had this major review into the Tavistock Institute, which did a lot of this sort of work, the CAS review. I thought we knew where we were now, and yet now we've got these tests being done on children under the age of 10. Why do we need it? Why is it being allowed? Why is it not illegal?
I mean, great questions. I don't think it's needed at all, and I certainly don't think that it's the right approach. It was one of the recommendations, I'm sorry to say, in the CAS report, which was the first and, at the time, far and away the best study of the whole idea of doing gender treatment for children. And it said that we needed more research because, as Baroness Cass rightly pointed out, the evidence base was appalling. There was really very little information out there. Even though these drugs had been used around the world for quite a while, proper follow-ups weren't done. And they certainly weren't done in the UK either. But the thing is, 9,000 children had been through the Tavistock. And of those, 2,000 received puberty blockers. But the adult clinics were so unwilling to cooperate with Hilary Cass that they refused to do what they called a data linkage study, which is to see how those 2,000 kids have fared as they grow up. To me, it is absolutely unethical and just inexplicable that they are exposing more children to these drugs, which we know have serious physical consequences, without finding out how those kids are doing first. I mean, yes, the design is better of the new trial, but I mean, compared with just finding out, like, how are they doing? How are these kids doing? Did they desist? Has their IQ fallen a lot? You know, do they all go on to cross-sex hormones? Are they all sterile? What's their bone density like? We could find out lots of things from those 2,000 kids before we expose any new children to this extreme risk of harm.
It does seem extraordinary that this has been given the go-ahead by the Ethics Committee. I mean, normally drugs in medicine are there to treat disease, but being born male is not a disease. Being born female is not a disease. I don't understand how this has got ethical approval.
A great question. I mean, we know very little about what the Ethical Committee did because these things are done quite privately, which is quite standard because otherwise you'd have a lot of lobbying from the pharmaceutical industry. So we haven't really seen what we need to from it. But we know from what they've said that they're talking about it's there to treat gender incongruence. It's not even gender distress or gender questioning anymore. I mean, you can't believe in the concept of gender incongruence unless you have enormously sexist.
Can you explain what it... Can you explain what that expression means? Because a lot of people are thinking,
no,
what?
I can't.
Gender
I can't,
what?
Because it's nonsense. It's nonsense. What it means can only be a little boy who thinks that he's more like a little girl, or a little girl who thinks she's more like a little boy. But that's nonsense. Some little boys are unusual boys. Some little girls are unusual girls. Some people are unhappy being the sex they are. Mostly they grow out of it. Some of them turn out gay. None of this needs treatment. They don't define gender incongruence. They just bring this in and say that's what they're treating, which is the first disgrace. We don't even know what they're trying to solve here. They're trying to solve something that doesn't need solving. As Miriam put it so well, being male is not an illness. Being female is not an illness.
Now, Helen, at the time when the CAS report was published, it was seen as a landmark turning point, really, against the progression into gender ideology. A few people did point out at the time that the potential for a further study left open this potential that we're now seeing carried out, and also the idea that some children are truly trans, which I think you and I probably agree is not true. But nevertheless, Hilary Cass had to walk an extremely difficult line. She faced huge backlash from the trans lobby, even with the report being as calm and conservative as it was. Do you think actually she had any other option in that moment but to recommend some sort of further research?
I'm afraid I do think that she could have been more careful on this one. She could have, for example, said that it would be unethical to do a further study until we had mined the data that we had available to us first. I think that was a mistake of hers, and I do think that there's a risk that she was not thinking about the wider context in which this study would happen. The issue I have always had all along on this, as well as the fact that there is nothing here to treat, and that these drugs are clearly a major intervention in a major developmental stage, namely puberty, is that what does it mean to tell a child that you can do something that puts them on a path to pretending to be the opposite sex for the rest of their lives? Like, this child, post the For Women Scotland judgment, this child is going to have to go into a school where everybody understands that they really are the sex that they actually are, and that they can't go stealth, as some children have up till now in schools, as the opposite sex. But that's the whole point of puberty blockers, is they're meant to help you to pretend more effectively that you're the opposite sex. So if the children are taking puberty blockers but they aren't allowed to socially transition in schools, this makes the whole thing a nonsense. What are the doctors telling these children to get consent? What are they going to tell the parents? We can give your child this intervention, but they're not going to be allowed to pretend to be the opposite sex in school, and they will never be allowed to pretend that in future for the purposes of single-sex spaces. It makes the whole treatment pathway a nonsense.
But even the children on the trial, Helen, what if it does do them some damage, the trial? How do you undo it? You
can't undo it. This idea that puberty blockers are reversible, which is what they used to say but don't say anymore, was always nonsense, because time can't flow backwards. A child who misses a year's development as part of their cohort has missed something you can't get back. And I mean, they're still saying that they will put off the cross-sex hormones till 16, so they're expecting to have children on puberty blockers for a very long time. I mean, you remember what it was like going through puberty. Anyone who's had children listening to this knows that puberty is an extraordinary time in which children are turned into adults, often quite a difficult time, because that's a major task. So your brain changes, your body changes. It's when you work out what your sexuality is. It's when you free yourself from adults and you become an adult yourself bit by bit. They're sticking a spanner in all of that and saying they're going to keep this child in a state of suspended animation. Even if the child comes off blockers, that's something that's done them harm for the rest of their lives. This is a totally unethical treatment pathway, and I'm so distressed. I really thought it wouldn't get ethical approval, I have to say. It's one of the reasons that I wasn't that worried about it being in the Cass report, was that I just couldn't see how it could get ethical approval. You know, it's probably going to face legal challenge.
Yeah.
But where are the politicians on this?
Well, I was going to say, Wes Streeting has in the past been seen as one of the relatively sensible and open-minded people on the left, and yet he has welcomed this trial on Twitter.
It's a lack of responsibility everywhere. Nobody is willing to take responsibility. I mean, as you say, Wes Streeting has generally been rather good on gender issues, but what he has said is he will follow the science. But the scientists, and I'm sure this is true for the Ethics Committee, they were answering a rather narrow question. You know, how can we design this to maximise the amount of information we get? By the way, it's a very poor study. It's really short term. Like most of the things that we would expect to see as harms from this are long term. But, you know, how can they do it? How can they arrange the forms for consent? That sort of thing. They're not thinking big picture, and they're certainly not thinking about the child as a child who'll go to school and move around in the world and grow up, and what For Women Scotland means for this. That's not their job. So each person is doing their narrow little bit of it, and everybody is saying it's somebody else's job to look at the big picture and protect children. It's really distressing.
It really is. Well, Helen, thank you for that. That's Helen Joyce, who is Director of Advocacy for Sex Matters. We've got a statement from the Department of Health and Social Care, which says,
young people with gender incongruence need access,
whatever that means,
need access to high-quality, safe and effective care. We are following the Cass review, which was clear that the evidence on care for these children is lacking, and proposed this research to help provide it. Medical care must always be based on solid evidence, and children's safety must come first.